Yeah, hi, I'm Chungsoo from Ajou University in South Korea, and very happy to share our team's work today. The title is Scalable Infrastructure Supporting Reproducible Nationwide Healthcare Data Analysis Toward Fair Stewardship. This is published in Scientific Data, and I am the co-first author for this paper. I'm always excited and happy to talk about this paper because it reminds me our team's huge efforts so far. I'm in the OHDSI Korea chapter. Korea has nationally adopted the CDM as a healthcare data infrastructure. Many of you already know about this slide, but OHDSI Korea is still expanding, so we updated this picture whenever the new data partners are added. Most of our data partners are actually medical institutions, but we also have very important data partners who have national claims data. These institutions are important because they manage the claims data for the whole Korean population, about 56 million people. The healthcare system of Korea has only one public insurance for all citizens in South Korea, so their data is nationwide, longitudinal, complete, and very highly valuable. Especially they include claims from all types of healthcare institutions like primary care, hospitals, tertiary hospitals, and pharmacy. So their data have demographic information, including income level, and also diagnosis, any prescriptions for medication, procedures, and measurements for the insurance claim. And even the information during the in-hospital inpatient period is also included, and they directly manage the reimbursement cost for their insurance, so they fully have the cost information too. Recently, data linkage between national agencies have been booming in Korea, so they carry forward more linkage with their claims data with other data too. For the short history of HERA CDM data, Professor Chan started his research with some of the HERA team member as a pilot study from 2018 to 2020, and they started to convert the whole data to CDM and analyzed it for estimation study. And finally, the result was published in JAMA. At that time, I think they saw the value of data in CDM format, but they also have some worries about whether to continue or to maintain it because they already provided their data to public in other ways. But in 2020, the COVID pandemic was started, but Professor Chan and Park requested HERA support for opening their data internationally for COVID-19 research. So our team supports the data open project of HERA because HERA was quite unfamiliar with the distributed research using OMOP. So I and some of my colleagues went to HERA twice or 3 days per week during this project. As a result, many research findings could support public health, and additionally, we were able to understand each other better with the HERA through this project. And I think the important thing was that through this process and project, HERA learned how to conduct research in a distributed manner using the CDM data. Therefore, we developed an analytic environment for CDM data internally, and were able to utilize CDM and Atlas for HERA internal researchers. But this wasn't easy because compared to the free, flexible outside environment, but the public institution couldn't access the internet, which means we couldn't access CRAN or GitHub. So we used the idea of Docker container to set up the internal environment outside of HERA and sent the Docker container to them and for use internally. And after past trial and error, we were currently using a Docker image containing all of OHDSI packages with a commercial data science workbench like Cloudera. So we decided to publish the entire process as a paper. We have tried to be transparent about all of our efforts in data conversion, quality checks, and ADI2's SNOMED mapping dictionary and sample data infrastructure, etc. In particular, we intended to minimize information inequality by satisfying the FAIR principle, findability, accessibility, interoperability, and reuse of digital assets by disclosing all of our information online. Surprisingly, HERA began opening its CDM to domestic researchers in Korea in 2022, and the second opening was successfully conducted in 2023 also. Yeah, that is not only Ajou University, but other institutions are also using this data and infrastructure. And currently, it is open once or twice a year, but HERA plans to establish a regular system for regular application in the near future. And according to relevant regulations, only researchers affiliated with Korean organization can apply for this analysis. So if you are interested, you can discuss it with closely with Korean data partners. But HERA is also eager to collaborate with the international community too. So yeah, that was a very quick summary. But I hope HERA keep this data open policy for domestic and international researchers and for the public health, hopefully. And I would like to especially thank to the HERA team and my PIs for their really hard work for this study. Yeah, thank you.